Hello guys, welcome to Medicine Simplified. Today we will know common cold medicines or drugs. So what is common cold? It is a viral infection caused by rhinovirus or influenza virus, commonly called as flu. These viruses invade mucosal tissue of upper respiratory tract, causing upper respiratory infection. Excessive mucus production results from the inflammatory response to this infection. Fluid drips down the pharynx into the esophagus and lower respiratory tract, causing cold symptoms like sore throat, coughing, upset stomach. Irritation of nasal mucosa often triggers the sneeze reflex. Mucosal irritation also causes release of several inflammatory and vasoactive substances, dilating the small blood vessels in nasal sinuses and causing nasal congestions. So what is the treatment of common cold? It involves combined use of antihistamines, nasal decongestants, antitussives and expectorants. Treatment is symptomatic only, not curative. So we relieve symptoms of common cold. Symptomatic treatment does not eliminate the causative pathogens. It is very difficult to identify whether common cold is caused by viral or bacterial. Treatment is empiric therapy, treating the most likely cause. Antivirals and antibiotics may be used, but viral or bacterial cause may not be easily identified. Coming to the antihistamines, drugs that directly compete with histamines for specific receptor sites. Two histamine receptors. First one is H1 histamine 1, H2 histamine. H2 blockers or H2 antagonists used to reduce gastric acid in PUD. Examples: cimetidine, ranitidine, famotidine. H1 antagonists are commonly referred to as antihistamines. Antihistamines have several effects like antihistaminic, anticholinergic and sedative. Mechanism of action of antihistamines: blocks the action of histamine at receptor sites. So they block action of histamine on receptor sites. Compete with histamine for binding at unoccupied receptors. These drugs compete with histamine for binding unoccupied receptors. So this drug binds with histamine receptors. Cannot push histamine off the receptor if already bonded. If histamine is already bonded, it cannot replace the histamine. More effective in preventing the action of histamine rather than reversing them. Should be given early in the treatment before all histamine binds to receptors. Side effects. Coming to the skin, block capillary permeability, peel and flare formation, itchiness. Anticholinergic side effects. Drying effect that reduce nasal, salivary and lacrimal gland secretions. Sedative. Some antihistamines causes drowsiness. Coming to the uses, it is used for management of nasal allergies, seasonal or perennial allergic rhinitis, also called as hay fever, allergic reactions and sleep disorders. Coming to therapeutic use, also used to relieve symptoms associated with common cold like sneezing, runny nose, palliative treatment but not curative. There are two types of antihistamines. First one is traditional or non-sedating peripherally acting antihistamines. Traditional, it's a older antihistamines, work both peripherally and centrally, have anticholinergic effects, making them more effective than non-sedating agents in some cases. Example, Diphenhydramine, commonly called as Benadryl, Chlorpheniramine, commonly called as chlorpheniramine, non-sedating or peripherally acting antihistamines, developed to eliminate unwanted side effects, mainly sedation. Works peripherally to block the actions of histamine, thus fewer CNS side effects. Longer duration of action. Example, Fexofenadine, commonly called as Allegra, Loratadine, commonly called as Claritine. Coming to the nasal congestion, it is excessive nasal secretion caused due to inflamed and swollen nasal mucosa. So what are the primary causes? Allergies, upper respiratory infections seen in common cold. So what is decongestants? There are two types, adrenergic, which is largest group. Second one is corticosteroids. They are available in two dosage forms, oral and inhaled or topically applied to nasal membrane. Oral decongestants. Prolonged decongestant effects are seen in oral decongestants, but there is delayed onset. No rebound congestion and exclusively adrenergic. Example, phenylephrine, pseudoephedrine. Coming to topical nasal decongestants, they are both adrenergic and steroids. They are prompt in onset and highly potent. Sustained use over several days causes rebound congestions, making the condition worse. So, prolonged use of topical nasal decongestants are not advised. Coming to the adrenergic, they are ephedrine, oxymetazoline, nafazoline, phenylephrine. Coming to intranasal steroids, beclomethasone, dipropionate, and flunisolide. What is the mechanism of action? Site of action is blood vessels surrounding the nasal sinuses. Adrenergic action. They constrict small blood vessels that supply upper respiratory tract structures. As a result, these tissues shrink and nasal secretions in the swollen mucosal membranes are better able to drain. Nasal stiffness is relieved. Relief of nasal congestion associated with acute or chronic rhinitis, common cold, sinusitis, hay fever, or other allergies. Coming to the side effects. Adrenergic side effects are nervousness, insomnia, palpitations, tremors. Coming to the steroid side effects, local mucosal dryness and irritations. Antitussive, physiology of cough. Respiratory secretions and foreign objects are naturally removed by cough reflex. So what is cough reflex? It induces coughing and expectoration initiated by irritation of sensory receptors in respiratory tract. There are two types of coughs. First one is productive cough, which is congested and removes excessive secretions. Second one is non-productive cough, also called as dry cough. What is coughing? Most of the time, coughing is beneficial, which removes excessive secretions and removes potential harmful foreign substances. In some situations, coughing can be harmful, such as after hernia repair surgery. Coming to the antitussives, these are the drugs used to stop or reduce coughing, which involves opioid and non-opioid. Only used for non-productive coughs, that is dry cough. What is the mechanism of action? Opiates suppresses the cough reflex by direct action on cough center in medulla. So they mainly act on medulla. Examples are codeine, hydrocodone, non-opioid. These drugs suppress the cough reflex by numbing the stretch receptors in the respiratory tract and preventing the cough reflex from being stimulated. So opioid act on medulla and non-opioid act on stretch receptors in respiratory tract. Examples include benzonatate, dextromethorphan. Coming to the uses, used to stop the cough reflex when cough is non-productive and harmful. Coming to the side effects, benzonatate causes dizziness, headache and sedation. Dextromethorphan causes dizziness, drowsiness and nausea. Opioid antitussives causes sedation, nausea, vomiting, lightheadedness, constipation. Coming to the expectorants. These are the drugs that aid in expectorations, that is removal of mucus. Reduces the viscosity of secretions. These drugs disintegrate and thin secretions. Mechanism of action. Direct stimulation or reflex stimulation. The final result is thinner mucus, that is easier to remove. Coming to the direct stimulation, the secretory glands are stimulated directly to increase their production of respiratory tract fluids. Example are terpene hydrate, iodine containing products such as iodinated glycerol and potassium iodide. Coming to reflex stimulation, these are the agents causing irritation of GI tract. Loosening and thinning of respiratory tract secretions occur in response to this irritation. Example are guaifenesin syrups of ipecac. Coming to the drug effects, effects are seen by loosening and thinning sputum and bronchial secretions. The tendency to cough is indirectly diminished. So what are the common side effects? Guaifenesin causes nausea, vomiting and gastric irritations. Terpene hydrate causes gastric upset. If you like this video, please do subscribe to our channel. Thank you.